A patient has an 4 line running in the left arm. The phlebotomist must draw blood and both arms appear accessible. What is the best course of action? A. Draw from the left arm above the foresight. B. Draw from the left arm below the foresight. C. Draw from the right arm. D. Ask the nurse to stop the 4 and draw from the left arm. Answer: C. Blood should be drawn from the opposite arm when a patient has an 4 to prevent contamination with 4 fluids. Drawing above or below the foresight can still lead to inaccurate results. Which of the following additives is found in the green top tube? A. EDTA. B. Sodium citrate. C. Sodium heparin. D. Thrombin. Answer: C. Green top tubes contain sodium heparin, which prevents clotting by inhibiting thrombin and is commonly used for plasma determinations in chemistry. When preparing to draw blood using a butterfly needle, what angle should the needle be inserted? A. 15 to 30 degrees. B. 25 to 45 degrees. C. 5 to 15 degrees. D. 30 to 45 degrees. Answer: A. When using a butterfly needle for blood collection, insert the needle at a 15 to 30 degree angle to the skin. This helps ensure proper vein entry and minimizes discomfort or complications. What is the proper order of draw when collecting blood for a complete blood count, CBC, prothrombin time, PT, and a metabolic panel? A. Light blue, green, lavender. B. Green, lavender, light blue. C. Light blue, red, lavender. D. Light blue, lavender, green. Answer: A. The correct order is light blue, coagulation, green, chemistry, then lavender, hematology. This avoids cross-contamination between additives. Which test requires the sample to be collected in a tube containing EDTA? A. Glucose. B. Blood culture. C. Complete blood count. D. Electrolyte panel. Answer: C. A complete blood count, CBC, requires an EDTA tube, lavender top, which prevents clotting by binding calcium. What should a phlebotomist do immediately after removing the needle from the patient's vein? A. Apply a bandage. B. Invert the tubes. C. Activate the safety device and apply pressure. D. Label the specimen. Answer: C. The safety device should be activated to prevent needle stick injury, and pressure applied to stop bleeding before labeling the specimen. A specimen must be protected from light. Which of the following tests does this apply to? A. Potassium. B. Bilirubin. C. Calcium. D. Creatinine. Answer: B. Bilirubin is light-sensitive and must be protected from light to prevent breakdown, which can alter test results. Which vein is most commonly used for venipuncture? A. Basilic vein. B. Median cubital vein. C. Cephalic vein. D. Femoral vein. Answer: B. The median cubital vein is the preferred site due to its size, accessibility, and low risk of complications. Which of the following errors may occur if a tube is not inverted properly after collection? A. Sample may clot. B. Sample may hemolyze. C. Sample will dilute. D. Sample will coagulate faster. Answer: A. Tubes with additives must be inverted gently to mix and prevent clotting. Failure to do so may result in an unusable sample. Which tube should be used to collect a blood sample for a blood culture? A. Gray top tube. B. Yellow top SPS tube. C. Red top tube. D. Lavender top tube. Answer B. The yellow top SPS tube is used for blood cultures as it contains sodium polyanethyl sulfonate, which supports microorganism survival. What is the maximum time allowed between blood collection and plasma separation in a gray top tube? A. 10 minutes. B. 30 minutes. C. 1 hour. D. 2 hours. Answer B. Blood collected in a gray top tube should have plasma separated by centrifugation within 30 minutes of collection to ensure accurate results and prevent glycolysis. What is the proper protocol if a phlebotomist accidentally punctures an artery instead of a vein? A. Apply light pressure and continue drawing. B. Continue drawing but apply pressure after. C. Remove the needle and apply firm pressure for at least 5 minutes. D. Notify the lab manager immediately without removing the needle. Answer C. Arterial puncture requires firm pressure to prevent hematoma or prolonged bleeding due to higher pressure in arteries. Which of the following patient identifiers is acceptable before drawing blood? A. Patient's bed number. B. Patient's room number. C. Patient's full name and date of birth. D. Verbal confirmation only. Answer C. 2 identifiers, typically the patient's full name and date of birth, must be verified to ensure correct patient identification. What should be done if a hematoma starts forming during venipuncture? A. Continue drawing. B. Stop the procedure and apply pressure. C. Redirect the needle. D. Switch to a butterfly needle. Answer B. If a hematoma begins forming, stop immediately and apply pressure to the site to prevent further tissue damage. A lavender top tube is most appropriate for which of the following tests? A. Electrolyte panel. B. Hemoglobin A1C. C. Liver function test. D. Blood urea nitrogen. Answer B. Hemoglobin A1C is a hematology test and should be collected in an EDTA tube, lavender top. What is the function of the tourniquet in phlebotomy? A. Prevents the vein from collapsing. B. Slows venous blood flow and makes veins more prominent. C. Increases arterial flow. D. Reduces the risk of hemolysis. Answer B. A tourniquet constricts blood flow, causing veins to fill and become easier to locate for venipuncture. What is the minimum volume required for blood cultures in an adult patient? A. 2 milliliters. B. 5 milliliters. C. 8 to 10 milliliters. D. 12 to 15 milliliters. Answer C. Blood cultures typically require 8 to 10 milliliters per bottle to maximize detection of pathogens. What is the main risk of using the basilic vein for venipuncture? A. It is less visible. B. It is close to a major artery and nerve. C. It causes more pain. D. It collapses easily. Answer B. The basilic vein lies near the brachial artery and median nerve, increasing the risk of injury during puncture. Why should the first drop of blood be wiped away during a capillary puncture? A. It prevents clotting. B. It prevents contamination with interstitial fluid. C. It increases flow. D. It makes it easier to collect. Answer B. The first drop may contain tissue fluids and debris, which can contaminate the sample and affect test accuracy. What type of precautions should be used when drawing blood from a patient with tuberculosis? A. Standard precautions only. B. Droplet precautions. C. Contact precautions. D. Airborne precautions. Answer D. Tuberculosis requires airborne precautions due to its transmission through fine particles in the air. Which of the following complications is most likely when excessive force is used during blood draw with a syringe? A. Hemolysis. B. Hypoglycemia. C. Hemoconcentration. D. Lipemia. Answer A. Excessive force can rupture red blood cells, leading to hemolysis and potentially inaccurate test results. The term fomite refers to A. A type of bacteria. B. A sterile item. C. An inanimate object that carries infection. D. A living host for pathogens. Answer C. Fomites are objects, e.g., tourniquets, gloves, that can transmit infectious organisms between patients. When should a blood specimen be labeled? A. Before collection. B. During collection. C. After leaving the room. D. Immediately after collection, in the patient's presence. Answer D. Labeling must occur immediately in the patient's presence to avoid mix-ups and ensure accuracy. Which condition may cause a falsely elevated potassium level in a blood specimen? A. Hemolysis. B. Clotting. C. Leukopenia. D. Lipemia. Answer A. Hemolysis causes potassium to leak from red blood cells into serum/plasma, falsely elevating potassium levels. Why is it important to avoid vigorous shaking of blood tubes? A. It causes the blood to freeze. B. It promotes bacterial growth. C. It may cause clotting. D. It may lead to hemolysis. Answer D. Vigorous shaking ruptures red blood cells, leading to hemolysis, which can affect the accuracy of many tests. What is the best method to identify an unconscious patient in an emergency room setting? A. Ask a family member for confirmation. B. Rely on the ID band attached to the stretcher. C. Use a temporary ID provided by hospital protocol. D. Use verbal confirmation from staff. Answer C. Unconscious patients must be identified using temporary identifiers assigned by the facility to ensure sample accuracy and patient safety. Which of the following actions by the phlebotomist may compromise the sterility of a blood culture draw? A. Using chlorhexidine for skin prep. B. Touching the site after cleaning. C. Drawing blood from a butterfly needle. D. Using alcohol after iodine. Answer B. Touching the site after it has been cleaned can contaminate the draw and lead to false positive culture results. During a venipuncture, the patient suddenly faints. What is the first action the phlebotomist should take? A. Stop the procedure and call for help. B. Keep drawing the blood quickly. C. Hold the patient upright in the chair. D. Splash water on the patient's face. Answer A. Fainting poses safety risks. The procedure must be stopped immediately, and assistance should be requested. What is the correct procedure for collecting a blood specimen from a patient with a known latex allergy? A. Proceed as usual and monitor for signs of a reaction. B. Use non-latex gloves and equipment. C. Delay the draw until cleared by a physician. D. Use powder-free latex gloves. Answer B. Patients with latex allergies require non-latex supplies to avoid allergic reactions, which can be severe. Which of the following tests should be drawn without using a tourniquet if possible? A. Bilirubin. B. Ammonia. C. Prothrombin time. D. Complete blood count. Answer B. Ammonia levels can be falsely elevated by prolonged tourniquet application. It's recommended to draw without a tourniquet if possible. Why should the phlebotomist avoid drawing from a site with edema? A. It may cause severe pain. B. It can yield inaccurate results. C. It makes the vein more visible. D. It is closer to an artery. Answer, B. Edematous tissue can dilute the sample and cause inaccurate results due to tissue fluid contamination. The order of draw is important in phlebotomy because A. It ensures all tubes are filled equally. B. It prevents the patient from bleeding. C. It avoids cross-contamination between additives. D. It maintains the vacuum in the tubes. Answer, C. Using the correct order of draw prevents additives from one tube affecting tests in subsequent tubes. A phlebotomist accidentally punctures the median nerve during a blood draw. What symptom is the patient likely to report? A. Dull ache near the shoulder. B. Shooting pain or tingling in the arm or hand. C. Swelling at the site. D. Redness and itching. Answer, B. The median nerve controls sensation in parts of the hand and arm. Injury causes sharp, tingling pain. A patient is required to fast for 12 hours before testing. Which test is most effective if fasting instructions are not followed? A. CBC. B. Lipid panel. C. Sodium. D. Prothrombin time. Answer, B. Eating before a lipid panel can result in falsely elevated triglycerides, leading to inaccurate results. What is the main function of EDTA in blood collection tubes? A. Enhances clotting. B. Prevents clotting by binding calcium. C. Preserves glucose. D. Activates enzymes. Answer, B. EDTA is an anticoagulant that works by binding calcium, a necessary component of the clotting cascade. Which specimen must be placed in an ice slurry immediately after collection? A. Bilirubin. B. Glucose. C. Ammonia. D. Hemoglobin. Answer, C. Ammonia is unstable and must be chilled immediately to prevent breakdown and ensure accurate results. Which of the following errors will most likely lead to specimen hemolysis? A. Drawing too slowly. B. Using a needle that is too small. C. Letting the tourniquet remain on for less than 1 minute. D. Using a straight needle in the hand. Answer, B. A needle that is too small can cause shearing of red cells during draw, resulting in hemolysis. When should a capillary puncture be performed instead of venipuncture? A. When a large volume of blood is needed. B. When the patient is severely dehydrated. C. When veins are difficult to access or for point-of-care testing. D. When the specimen is for blood cultures. Answer, C. Capillary draws are ideal for small volume testing or when venous access is challenging, such as in children. What should be done if a blood specimen is accidentally drawn in the wrong tube? A. Relabel it with the correct tube label. B. Run the test anyway. C. Discard it and recollect using the correct tube. D. Mix it with a new tube. Answer, C. Specimens collected in the wrong tube can lead to inaccurate results and must be recollected correctly. What is the proper antiseptic for cleaning a venipuncture site for blood alcohol testing? A. Isopropyl alcohol. B. Iodine or chlorhexidine. C. Acetone. D. Soap and water. Answer, B. Alcohol should not be used for blood alcohol testing, as it may contaminate the sample. Iodine or chlorhexidine is preferred. If a patient's arm has a cast and 4 on the left side and a fistula on the right, where should the phlebotomist draw? A. Left arm below the 4. B. Right arm below the fistula. C. Consult with a nurse or provider. D. Left hand. Answer, C. In complex cases with limited access, phlebotomists should consult a provider to avoid patient harm. A test result shows an elevated white blood cell count. Which factor could have caused a false elevation? A. Stress or crying before draw. B. Fasting for 12 hours. C. Collection in a heparin tube. D. Delayed processing. Answer A. Physical stress, anxiety, or crying, especially in pediatric patients, can temporarily increase WBC count. What is the primary risk when performing venipuncture in the leg or foot? A. Increased pain. B. Lower accuracy. C. Risk of thrombosis. D. Poor visibility. Answer C. Drawing from leg or foot veins increases the risk of clot formation, thrombosis, so it must be avoided unless approved. If a blood culture bottle is underfilled, what may happen? A. Contamination risk decreases. B. False negative results. C. Elevated white blood cell count. D. Increased clotting. Answer B. Insufficient sample volume can prevent pathogen detection, leading to false negative culture results. The term lipemic describes a sample that A. Contains bacteria. B. Appears yellowish due to bilirubin. C. Appears milky due to high fat content. D. Clots rapidly. Answer C. Lipemic specimens look milky or cloudy due to high lipid, fat, levels, which can interfere with some test results. What is the appropriate action if a patient refuses a blood draw? A. Explain the importance and then proceed anyway. B. Immediately restrain the patient. C. Respect their decision and notify the provider. D. Leave the room without documenting anything. Answer C. Patients have the right to refuse procedures. The refusal should be respected and reported immediately. Which of the following additives promotes clot formation? A. Sodium citrate. B. EDTA. C. Silica particles. D. Heparin. Answer C. Silica in serum separator tubes, SSTs, promotes clotting and is used in tubes for serum-based tests. What is the purpose of using a discard tube when drawing with a butterfly for coagulation testing? A. It avoids contamination. B. It prevents platelet activation. C. It clears the air from the tubing. D. It labels the tubes correctly. Answer C. A discard tube is used to clear the air in the butterfly line to ensure accurate coagulation testing volume. Which of the following situations requires contact precautions? A. Tuberculosis. B. Influenza. C. Clostridium difficile infection. D. Measles. Answer C. C. Difficile spreads through spores on surfaces and requires contact precautions, including gloves and gowns. Which of the following tests is most likely affected by hemolysis? A. Hematocrit. B. Potassium. C. Glucose. D. Blood culture. Answer B. Hemolysis releases intracellular potassium from red blood cells, falsely increasing serum potassium levels.